Good afternoon and welcome to the Daily Briefing. I'm joined today with Chairman Kern, and Sam Bierman from the Health Department is back with us. Sam, thanks for joining us.
Happy to be here. So today we had the mass vaccination site still going on. For any of those who were down there today, thank you for being patient with the weather. It was a little rainy out, but we were able to get through and continue operations. So as of today, we have tested 307,155 St. Clair County residents, which is an increase of 1,011 from yesterday. We have 29,112 positive test results, which is an increase of 46 from yesterday. And that does include both males and females from under the age of 10 up to their 90s. Today, our daily county positivity rate is 4.5%, and we have 278,043 negative test results. We have 466 deaths, so we are adding an additional death today. A man in his 60s who had unknown health conditions, and as always, our sympathies go out to his family. For those who have completed the IDPH required 10-day isolation period, we are at 28,248. For state totals, 19,726,135 have been tested, with 1,224,915 positive test results, which is an increase of 1,832 from yesterday. And for deaths, the state is reporting 21,116, which is an increase of 13 from yesterday. For hospitalization numbers in St. Clair County, currently we have 30 patients that are admitted due to COVID-related reasons, and 5 of them are on ventilators. Regionally, we have 68 patients that are admitted due to COVID-related reasons, and 6 of them are on ventilators. We have no new additions to our long-term care and congregate living facility list, so I will turn it over to Chairman Kern for his update.
Thanks, Sam. I'm going to put you on the spot for a second.
Okay.
So I noticed we've got appointments that are open still for this afternoon and for Thursday and Friday.
That is correct.
And through the weekend. So let's talk just for a second. Who is eligible to get a shot now?
Sure. So we'll start back at the beginning. So any 1A, which is any frontline healthcare worker that has any direct patient contact, is eligible. Then moving down, we went to frontline, or essential workers, which was that first group. So that was United States Postal Service workers, some people in production and manufacturing. And then we went to the 16 to 64-year-old category with underlying health conditions. And that is any health condition for that age range. And as of Monday, we moved into the next tier, which included, oh my goodness.
Which includes
What are they?
Government?
Oh, government, media, and higher education.
and then also anybody 65 and above.
Correct.
No matter what health conditions, if you're 65 and above, you're eligible. So really, we're generally talking about most people that go through the list are eligible for a shot now.
That is correct. And if you haven't signed up because you aren't aware how to, we do have the call center that is available, staffed 7 days a week, and you can actually speak to someone live on the phone. They can direct you how to go through the process because we do have plenty of appointments still available for today and for the rest of the week.
And what that means is that people can get through pretty quickly.
Yes, they can. I know we had some people come through that were talking to our National Guard when they were out in the observation lot between the showers this morning, and I believe they said 25 minutes, and that was with their observation time. So it was very quick in and out.
That's great. And now you see Krispy Kreme's giving away free donuts to people who get vaccinated. All sorts of perks coming up. So now is a good time to get your shot.
It is.
Pfizer. We were doing Pfizer today.
We are doing Pfizer today and the rest of the week.
Okay.
This.
Thank you, Sam. You
Absolutely.
did well, even though I put you on the
Oh
spot.
man, I blanked out for a second.
Team St. Clair. And don't look to me for help. I have very little of it. So we'll move into the zip code report. I do have that. 62203, we're up 1 today to 620. 62205, up 1 to 638. 62206, up 2 to 1,297. 62208, up 1 to 1634. 62220, up 2 to 2,084. 62221, up 4 to 2787. 62223, up 3 to 1765. 62226 up 8 to 3,216. 62232 up 1 to 904. 62239 up 1 to 476. 62243 up 1 to 778. 62254 up 3 to 803. 62255 up 1 to 80. 62258 up 3 to 1,057. 62260 up 3 to 803. 62269 up 7 to 3,277. And finally, 62285 up 2 to 572. 46 new positives today, 1,011 people got tested. That brings our daily county positivity down to 4.5%, which brings our rolling average then down to 4.4%. Regional positivity is up today to 3.1%. And that's because of and derived by the counties that are in our region. Bond County is at 8.3% today. Clinton County, 5.3%. Madison is at 7%. Monroe's at 5.7%. Randolph is at 0.6%. St. Clair is at 1.7%. And Washington County is at 6.9%. So Brian, you know those categories just like the back of your hand.
We've been living them for several days.
Several months.
Yeah, definitely. The time has come that most people, if you take the time to walk through all the different categories, all the different underlying medical conditions, most people are qualifying. We've talked to a lot of people in the call center, a lot of people that have just called our office directly. Once you walk through all those different areas with them, they're like, oh, I didn't realize I qualified for that. And we're able to get them in right away. We're working every day to expand those categories. We know, as you've said in the past, no later than April 12th will it be open to everyone. But if we can make that sooner, I know Director Simmons and Myler are working as quickly as they can to make all those things happen.
And underlying health conditions, smoking, that's makes you eligible. There's a lot of things that make people eligible. That's why you've seen a lot of your neighbors go there and get their vaccines. And so we want everybody to follow suit. The more needles we get in arms, the sooner we get through this, we can get back to our normal schedules.
Yeah, absolutely. It's been a long 375 days. As we talk about every day, that light at the end of the tunnel is getting brighter and brighter, but we just got to stay on track and keep pushing towards that.
So where's Herb today?
So Herb's with us today. He's in another meeting right now that's running a little bit over, so he asked me to sit in. But as we talk about every day, the show has to go on, and we have to make sure that we're covering all the bases that we need to. So.
And Brian, if I can add, our vaccination site is not just for residents of St. Clair County. Anyone who lives or works in Illinois is eligible to come to our mass vaccination site. So you don't have to live just in St. Clair County. It is open to everyone that lives or works in Illinois.
So definitely being one of the regional mass vaccination sites,
Yes.
It's good that we have that capacity and availability. Mm-hmm. And as more vaccine arrives and more eligibility opens up, we're gonna see the site filling up those appointments. So we thank you for joining us as you do every day. We do have Cindy back with us today to translate this into our Spanish communities, and then we'll be back tomorrow for day 376. Thanks for joining us.
One of the ways we can combat widespread infection is testing. It's been proven time and time again that many people who were infected with COVID-19 are asymptomatic, showing no signs of infection. They unknowingly spread the virus to those most vulnerable in our community. Working together with health departments in our region, free testing has been made available throughout the area, and we encourage all citizens and visitors to take advantage of this opportunity. To Team St. Clair and the rest of Region 4, if we work together, we can and will stop the spread of COVID-19.